What actually is biomimetic dentistry? I think in the last few years, it's become like a buzzword in clinical dentistry. Is it the same as adhesive dentistry? What is this decoupling time or decoupling with time? And how can we follow simple steps to improve our bond strength? Because essentially, from my understanding of biomimetic dentistry, it is like extreme bonding, basically. It's extreme adhesive bonding and using a set of philosophies and guidelines, following the literature to get the best bond strengths possible. Today, I've got on Dr. Taylor Paton, and I love him because he's a young dentist. Like, he's super young, and I respect that a lot because he's got something to share. He's got a fantastic online resource all about his passion and his learning and his journey with biomimetic dentistry. And sometimes what happens in education is that the grand master, the king of any discipline within dentistry, they are so far removed from the plights and the struggles of that learner that sometimes they may not be the best person anymore to introduce someone to that topic. So I think Taylor, what he presents today, is a young Scottish dentist, and I love his energy and his knowledge. You know how much I love geeky dentists, and so therefore I've got him to talk about biomimetic dentistry, answering my questions from the lens of a young dentist who's just very well read up and very keen in this field. And that way he's also learning, and therefore as us, we are all learning together with him. I think this episode is more impactful as an introduction to biomimetic dentistry than if I got on an established superstar that's already well known. So Taylor, keep up the good work, my friend. Hello, Protrusive. I'm Jazz Galati, and welcome back to the Protrusive Dental Podcast. If you're listening to this, I love you. Thank you so much. If you're watching this, then you can see the hoodie that I'm wearing. Oh my goodness. Dr. Neki Jamal, the dentist who made the Third Molars Online course, the course I always rave on about as the course to learn wisdom tooth surgery wherever you are in the world, because it's online. It really helped me start tackling cases. He has this fantastic merchandise. This hoodie has got a photo of Drake wearing a mask and wearing loops. It just looks brilliant. So thank you, Neki, for sending it all the way from Canada. I absolutely love it. In fact, I'm lecturing tonight at local BDA Kingston branch. I'm talking about how to stop your composite veneers from chipping, and I'm going to be wearing this hoodie tonight. So I'm doing something quite brave. Borderline unprofessional, is it? I don't know. Maybe it's just a new thing now, and we can be a little bit, I don't know if it's unprofessional. I think my heart's in the right place here, but this is representing the future of education. So if you're listening, watching, and you're wanting to learn more about wisdom tooth extractions and see videos of surgeries to guide you in your own practice, there's only one course in the world to check out. That's Neki Jamal's Third Molars Online. It's on thirdmolarsonline.com, and if you use Protrusive at checkout, you guessed it, you get a 15% off. So that's thirdmolarsonline.com. Use Protrusive for 15% off. And trust me, you will not regret it. It is a fantastic resource for anyone who wants to do third molars in practice. The protrusive dental pearl I have for you is how to block out a metal post. So imagine you take off an old crown and you find an ugly metal post inside, and now you want to place your future crown, and maybe you don't want to use PFM, maybe you don't want to use porcelain fused to metal, maybe you want to use a ceramic for whatever reason, and therefore sometimes to mask that metal substructure can be very difficult. It can have shine through, it can look very ugly. So what you can do is you can use something like Ivoclar Direct Opaque. It's like this flowable resin, which is a masking agent. It's there, it's extremely opaque. It's like Tipex for teeth. And essentially you put your air abrasion, adhesive, and you paint this on. Like for those of you watching, you paint it on the tooth, you cover the post with it, or you cover the metal with it. And it can also be used for really dark cavities. Like sometimes you remove an old amalgam and it leaves a really dark base. And if you go ahead and restore with your usual body shade composite, it will look really gray, it'll look really ugly. So if you put a base of opaque resin, it doesn't have to be Ivoclar, it could be any brand. I know Cosmodent do a very popular one, pink opaque. Anything to opaque to block it out, whether that's the metal post or that's the base of a dark cavity, using an opaquer like this can really bring your restoration to life, or it can prevent that shine through. So top tip for today is to consider, it's one of those things that it's good to have in your armamentarium, a syringe of a masking resin. This episode is sponsored by the Academy of Implant Excellence, and they have a flagship course by that man himself, Dr. Pav Kaira. Let's hear a few words from him.
There's no secret to success. There's a system to success. And I've developed a 3-step training program if you want to start your implant career, or if you've already started and you want to accelerate it. Knowledge clarity, knowledge depth, and building muscle memory so it becomes second nature to you. I've taken all of my years of experience, everything that I've learned from my MCLIN Dent and all of the courses that I've attended, and condensed it into the Academy of Implant Excellence course. If you want to know more, head to the website page and you can learn everything that I'm going to be including in that course. I am so excited. It is going to be absolutely phenomenal, and I am ready to give you guys my knowledge.
That was indeed Dr. Pav Khair from the Dental Implant Podcast. Do check it out if you haven't already. And if that interests you, do check out his website, academyofimplantexcellence.com. That's academyofimplantexcellence.com. And of course, you can check it out in the show notes. That's all from me, and I'll catch you in the outro. Let's listen to Dr. Taylor Paton now. Taylor Paton, welcome to the Protrusive Dental Podcast. How are you, my friend?
Oh, very good. Thanks, Jazz. And thanks so much for having me. I'm saying that there, it's very, very, very surreal. So I think you've been the soundtrack to my very long commute to VT this year. So it's been, I feel like I've been listening to you in my ear every car journey. So it's crazy to be actually talking to you now. So thanks very much for
Absolutely,
having me.
An honour to have you on. You're a Protruserati, as we connected on Instagram.
That's right.
And then I remember, do you remember when we first were messaging on Instagram, and I was really liking your page, the hybrid layer, and so I'll be sure to put everything in the show notes for everyone to click on and find you. But then you had this and it's very normal. It's good to have this. You had this little imposter syndrome. You said, but I'm only in DF1. So guys, Taylor's in Glasgow. He's at the end of his DF1, but I haven't seen such beautiful commitment from someone, such a young dentist before. And I said, look, you need to come on the show. We need to talk about your journey. I also want to learn from you about biomimetic dentistry. And then you probably had some imposter syndrome. And did you have that firstly?
Oh, definitely, yeah. And I think you were. I was actually listening to that the other day. Actually, I think you were talking to that about one of your other guests the other day. And I think it's definitely. I would agree with yourself though, in that it's a good thing as well. Definitely in terms of biomimetic dentistry, because it's definitely not the sort of thing that, I know we're obviously doing this podcast, but not the sort of thing that you listen to one podcast and you're suddenly an expert and know what you're doing. Even at my stage, I still feel there's so many parts of it. I'm using some of the basic principles and that sort of thing, but there's so much of it that I'm still not completely comfortable with, even though I've kind of made the website and that sort of thing. So I think it is good to have a bit of that. Imposter
I think the main reason I wanted you on, to tell you, I could have had someone who's got 25 years experience, but I think the beauty of now and again having different levels of experience. So you've only had 1 year experience in clinical practice, but from the website, from your Instagram page, your dedication, your hunger is so evident. And I want to extract that and share that. And sometimes, when you speak to someone who's really super experienced, they forget the struggles that they had earlier on. So you're very much in the midst of the struggles of a very young dentist. And I feel as though the audience, some of the audience will be able to connect so well with you, and you'll be able to break it down in a way that, I might have forgot what it was like 8 years ago to explain a certain concept. So I think I'm really excited to actually speak to you today about an area of dentistry which is very much modal. In the last 10 years, biomimetic dentistry has become a buzzword. It's also come under scrutiny by some experienced lecturers. They call it biopathetic dentistry. They say that, it's a fad name for just a brand of restorative dentistry. So let's just start with that, Taylor, okay? Before we then also talk about your journey and how you got into it. But essentially, What is biomimetic dentistry?
Yeah, so I would agree with you that in terms of the label biomimetic dentistry, it's quite a vague one, and it can be quite fluffy at times when you see it. So a lot of people, if you kind of start talking to them about it and they maybe haven't looked into it too much, the first thing you usually tend to hear is, oh yeah, that's just is that thing where you do the tabletop prep with the big smooth surface and an onlay that you're trying your best to stick on with your adhesive. And I personally think it's quite a bit more than that. And there's so many of these kind of biomimetic type dentists that there's so much to learn from them, just in terms of the fundamentals and the basics of just general dentistry as well, I would say. So I would kind of, asking about defining it, I would say it's obviously along the lines of adhesive dentistry, but adhesive dentistry in itself, I think you could see that as, say we've got a big hard zirconia crown, bonding that onto a tooth with a really heavy crown prep, that could be adhesive dentistry. I think biomimetic dentistry would then be beyond that, also then just kind of respecting how the natural tooth's built up and how the kind of natural tooth functions. So it's made of enamel and dentin, which are, they've got very specific properties. And I think it can be quite...
Would you say biomimetic dentistry is a philosophy?
I would say it would probably be just respecting that we're trying to build a tooth up the way that kind of nature intended. So I suppose the word biomimetic would be to mimic life. So I think especially early in your career like myself, I think it could be quite easy to, you're maybe looking at the likes of how to do crown preps and that sort of stuff. You're looking at materials, what materials should I use, whether it's Emax or Zirconia. Quite easy to think, oh, which material then is the hardest for this crown? So if you get a really hard zirconia, that's good. It's likely never going to break. But I think biomimetic dentistry as well is probably using materials that if there is some sort of failure, then you would probably rather that your restoration were to fail rather than the likes of a really hard non-biomimetic restoration that, yes, the patient might come in and you're a hero because their crown's completely intact and there's no chips or anything on it, but the rest of their tooth's fractured off at the gingival level and it's extracted and, implant, that sort of thing. Whereas biomimetic dentistry, I would think it would be accepting that you're not necessarily wanting to just go for the hardest materials. You're wanting to try and actually first kind of understand the way the tooth works and function. I was listening to someone talk recently actually, and they were kind of comparing it. I think it was Graham Milicic, have you heard?
No, but please tell me.
So I think he does a lot of research about the kind of compression dome concept of enamel. So that's basically where the enamel basically works. So the compressive forces on the tooth, it's kind of redirecting those vertical forces in the kind of cervical area of the tooth, and it's kind of distributing those to the dentin. And he's kind of saying, and a lot of biomimetic dentists are kind of saying that by doing these kind of aggressive, heavy crown preps that we're used to doing and taking away that kind of cervical area of the tooth, you basically don't want to do that because it's the strongest part of the tooth and it's the area that's receiving all that tension under function. So by taking that away, you're not really doing the tooth any favours. And that little area, the cervical kind of 2 to 3 millimeters, if you go on and read about biomimetic dentistry, you hear a lot of people calling that the biorim. So you hear a lot about kind of preserving that biorim, and with doing that, you're then taking a more kind of minimally invasive to an extent, but not going too far with that either. So if there's like a really thin cusp or that type of thing, it's not like an extreme minimally invasive, or you're relying on ridiculous bone strengths and that sort of stuff. I think it's more of an approach where you really are just, you're removing your caries, removing cracks, trying to preserve the vitality of the pulp.
I think the word approach is a good one there, Taylor, because from my perception, from what I've seen, from what I was speaking, and also I actually did have David Allman on the podcast, but we had such massive connection issues they never actually got posted. Yeah. But from what I've seen and from speaking to lots of my colleagues who are, Herman is very active on social media. I'll have to put his Herman Tequila is his Instagram handle. So I speak to a lot about him with him about biomimetic dentistry, and what I like and why I'm open to it, and why I don't think it is a fad as some colleagues will say it is because it's an approach, it's a set of protocols, and no one else is talking about cariology, but biomimetic dentists are. No one else is talking about how to maximize bond strength. And actually, those 3 words is how Dr. David Allman described it when he had his brief little stint on my podcast. He said biomimetic dentistry is really maximizing bond strength. So is it adhesive dentistry, but what can you do to the tooth with your restorations to get the best outcome through the best adhesion possible. And also it's a way of preserving the longevity of teeth. So all these philosophies and the protocols that biomimetics has in place all lends itself to a favorable restorative outcome. So for me, I see it as a philosophy and a branch of restorative dentistry. Best practices is another way to think about it. How did you get drawn to this? Because most people qualified, 1 year, maybe haven't even heard of biomimetic dentistry. Are you finding that you're having to explain a lot to someone who you met who's like maybe at your level in terms of 1 year qualified or a dent student, and you're having to explain every time what biomimetic dentistry is? Yeah,
so I think how I kind of fell into it was, so I graduated, so it was 2020 it was Glasgow I graduated from, So we were the year that kind of stopped a bit earlier because of COVID as well. So we had that really abrupt stop. It was about March time where we were in the clinic one day, the next day, that's it, you're done. So there was a few weeks or maybe a couple of months of waiting about to see, oh, do we still need to do this last OSCE exam, that sort of stuff. And then after that, it just kind of fizzled out. That was it. So at that point, lockdown was happening. I had a lot of time on my hands at that point as well. There was the big influx of all the webinars every day. Like you couldn't keep up with too many webinars and stuff. There was one every morning, afternoon, night. You were kind of spoilt for choice really. And I think at that point, I was kind of then realizing, like, wait a minute here. There's just so much that I don't know from dental school really, and I think we'll come on to that a wee bit as well. But
I still feel like that every time, my friend. Don't worry, it's very normal to feel that way, and it's good to recognize it. It's the most important thing is to recognize that. Whoa, there's so much that you don't know that you haven't been exposed to, and then the more you learn about things, then the more you realize that actually I thought I knew crown lengthening, but then when you start learning about crown lengthening, when you do your first crown lengthening case, and then you're like, holy crap, I need to learn more about crown lengthening. So it's never ending, my friend. Embrace it.
Yeah. So I think that started off with all the webinars, that sort of stuff. I think at a similar point I probably found your podcast as well, and it's genuinely been so helpful for like this stage in my career as well. I don't know how much feedback you get from people at my stage and stuff, but it's genuinely completely changed my outlook on everything, and I'm not just saying that because you're there
much
as well.
Much appreciated. You can stay. We'll keep this interview running. Very good. No, thank you so much. It's nice to get feedback. It keeps me going. You know, sometimes where like today, I'm behind on my episode, and I've got so much to do behind the scenes, and you may not have seen actually, and I'll say it for everyone's benefit. You might have not seen this, but on YouTube now, the last couple of episodes, not only is the interview on the right side, but there's notes now coming up on the left side. So that's double our production time. But so let me know what you think of that. And guys, if you're listening, watching this, let me know. Should we continue working OT and maybe delaying the episodes a little bit to have the notes on the left as we're speaking, or is this a function that you really don't need? So yeah, something to get some feedback for. So feedback always welcome. Thank you.
Sounds good. No, yeah. So I'm one of the audio listeners. So I then kind of started listening to your podcast. I had quite a long commute this year. Like I was saying, it was about an hour there, an hour back. So I've listened to all the podcasts. From that, I was then just reading a lot more and following a lot of other dentists, and I think from that it was kind of on Instagram that I then fell into the little group of
there's a huge community on Instagram of biomimetic dentists sharing lovely things, great lessons, very educational posts which need to be respected. You know, whether you agree with biomimetic approaches or not, I think there's a beauty in sharing and presenting information on Instagram that is disseminating information and research. So I think we have to respect that.
Yeah. And at the start, I found there was so much information on these pages, and it wasn't just a case of, I think it's quite easy to, you think, oh, you're reading that stuff on Instagram, like that can't be the way of doing it. But it's all linked back to research articles and, reviews and that sort of stuff. So you can go away yourself and start reading through all those papers, and kind of a lot of the time I would then also form my own opinions as well. There'd be some things that people would post about and I would think, oh, I'm not too sure about that. But I think the more you kind of read about it, at the start it's quite overwhelming. I was reading it at the start thinking, I have no clue what any of them are talking about. And I think maybe after about 5-6 months or so of just continuing to read, and I then went to, there was a kind of online conference. It was quite big round about Christmas time. It was a Karma Dentistry Biomimetic conference. I don't know if you've heard of that. That's been on a couple of years now. So that had it must have been about 15 or 16 speakers, and learned so much from that. It kind of got to the point I just
quickly, who's your favourite speaker in biomimetic dentistry?
Oh, favourite speakers, I think,
if you had to pick one.
I always enjoy listening to the duo of David and Davey Alleman. Yeah, they're very, very, very entertaining. It was actually just in March this year I actually got to meet them at a hands-on course that was...
Of course, Tariq Bashir probably organised that, right?
Tariq Bashir,
that's right. The famous
club,
Scottish dentist, yeah.
That's right, yeah. So Tariq's great. So I think he's done the mastership programme with David and Davey, so he obviously knows his stuff, and I think if someone like that's, you know, following protocols like this, then, you know, he's sensible, and you can tell he just really knows what he's talking about. And I think, like you were saying as well, I don't think it does, even if you don't agree with all of it, it doesn't do any harm to have some of these concepts and approaches like in your toolkit really as well. So I know that, like, say yourself, you talk a wee bit about like the vertipreps and that sort of thing, and that wouldn't be then saying that you don't do things like that. It's just another, you know, approach to how you can do things. So
I'm very much against like dogmatic approaches. So if everyone's like two on one side, I think there are cases where I don't think you can solve it. And I mean this, you know, with humility. I don't think you can solve every single case with just one approach. So I can show you some rare cases where like you can't stick anything on this. You need to do crown thing, you need to do vertical preparations. You may need to use zirconia in certain cases to be able to fix it, okay, on this 75-year-old man, for example. Whereas other cases, biomimetic dentistry all the way. I mean, all the onlays that I do, I very much try and follow all that I've consumed so far when it comes to maximizing adhesive strength. So I think there's a beauty in learning from all the philosophies.
Yeah, I would completely agree with that as well. And yeah, I think sometimes people are quite quick when you're talking about the biomimetic type things to think that, oh, that's all that you then do. I know in my case just now anyway, if anyone's listening, it certainly isn't. I sometimes feel like I'm going to work and I'm kind of doing a completely different thing. So practice I'm at just now, it's like kind of heavily NHS type practice. So I'm to be fair, I'm spending most of my time going in and doing extractions, dentures, that sort of stuff. When I get the chance with composites, whether that be a wee anterior composite or a posterior composite, or the odd chance to get a little chance to do an onlay or that type of thing, I can then go into some of these concepts and use these things. But I would only do that if I'm absolutely sure that I definitely know what I'm doing, because you do hear a lot with the very experienced biomimetic dentists as well who are really keen on it, that they would rather have traditional dentistry done very well to them than someone who's maybe on the fence about the biomimetic dentistry and doesn't maybe completely know what they're doing. So I would think if maybe anyone's listening and think they want to jump straight into it, I would really, really just read up a lot about it. I think the best bet's probably to find a mentor as well, which
tell us, because you've been through this journey. You found Tarek obviously in Glasgow. You went to the course when David came along. So if you're speaking, if you've got your microphone to young dentists all over the world, and they wanted to take the next step to learning about biomimetic dentistry, maybe one or two of the key lessons. Do they have to fly to the States? Do they have to buy a book? What's the good first step?
So I would say, if I can be cheeky and plug the website for a second as
well.
Do
it, so because I loved it.
Yeah. So I've started up the little website, and the website it's called thehybridlayer.com. Also on Instagram as well, at the hybrid layer, where I share cases and that sort of thing. And the website, the main kind of goal of that was, I got to the stage where maybe after about a year or so of reading things, I felt like I would then see, you know, people asking things and that sort of thing, and it would get to the point where I thought, yeah, I can start and I know the answers to some of these questions. I can see that people are pretty confused, as I was at the start. And the kind of goal of the website was basically just to get some of that basic info down so that it can maybe even give people the chance to have a read at it. It saves you scrolling through, you know, thousands of Instagram posts that aren't in any order, trying to figure out what's happening. And that can give you just a little kind of basic insight into what it is, you know, the rough concepts, not necessarily read the website and then that's you a biomimetic dentist, but it can give you an insight into saying, is this the sort of thing you're maybe interested in? And if you are, there's, you know, I know I had the 2-day hands-on course with David and Davey Alleman. I would say even that sort of thing I knew quite a bit. I don't even know if the 2 days would be enough to then start doing it, but I know they also offer the kind of online mentorship programs as well. So I know there's the Alleman Centre for Biomimetic Dentistry, and some of the people they've trained have also got similar kind of centres throughout the world as well. So a lot of it's kind of looks like it's been done online, which I think makes sense as well. So I would definitely recommend if you are going to be kind of serious about it and trying to use it on a day-to-day basis, definitely try and find someone who knows what
Well,
they're
so
talking
much of
about.
our dentistry nowadays is adhesive dentistry. So if anything we can do to improve our adhesive dentistry. So what I'm going to do actually, Taylor, is I'm going to ask you the last question straight up, and then we'll go to some of the other ones. Because on this note, from what you've learned so far in your journey so far with Biomimetic Dentistry and a year at dental school, and because some of the knowledge that you have from dental school is more fresh, you will remember some more of the dental school learnings than I do, certainly. So I like that you have that recent background, plus all the courses that you've done in Biomimetic Dentistry and how passionate you are about it. Give us your top tips on improving bond strength. So this could be with either direct composite resin or bonding onlays. What are the key lessons that you can pass on in just a few moments?
Yeah, so I would say one of the main concepts that I didn't come across at all, maybe I missed it, but at dental school, was the fact that when you are forming that initial bond to the tooth, so if we imagine you've got your caries-free tooth, or if you're using the partial caries removal, you've got your peripheral seal and everything. I don't maybe come on to that with the caries dye and everything. But if you've got your tooth that you're happy to then say bond a direct composite onto, so an MO that you've prepared and you're happy with, when you do etch your dentin, prime the dentin, and use that first layer of adhesive, I didn't realise that adhesive, it takes time to mature, basically, so it takes time for that bond to form. And I'm not sure if that's something that I just missed, but I feel like it's a really quite important point, because
is that the decoupling time?
Yeah, that's right. So it's basically the concept where, so obviously there's the different types of bonding systems, so the total etch, self-etch, that type of thing. So obviously important, first of all, to understand what you're using, but if we assume you know what you're doing, you've etched appropriately, primed appropriately, and you've got your first layer of adhesive on there. Once you've got that
what if you're using something like a universal, so you've etched the enamel and now using a self-adhesive universal, and then that's got the prime and bond mixed into it, can it still apply? Can you still apply this philosophy of decoupling time, or does it lend itself more to a separate primer and separate adhesive stage?
So I would say, just based on whatever, I think if you're using a universal bonding system, which I'd imagine a lot of people will be using, you're naturally maybe not going to quite reach the absolute best bond strengths that you possibly can, but I would say that
I think everyone who uses universal bonding agents, I think we know that. I think we know that. From the papers in the past anyway, the OptiBond FL was so high, and then everything else is always a bit lower. I don't know which is the king of adhesives now. Maybe you could fill me in terms of what you've read. But yeah, certainly I think when we use universal, we know that for convenience, we accept a little bit of a compromise, but we're hoping that it's not a massive compromise and still good enough to get a long-lasting restoration. But I think let's go with that 4th generation or 5th generation. So we're going to do etch, rinse, and make it really tangible now. So we're going to prime, and then sometimes you need a couple of coats of primer. That's why I was taught. So please tell me if, good. Get a nice shiny surface, get that dry, and then you're going to be using your adhesive. And then is that when you're waiting time? But just tell us more about how this decoupling works.
Yeah, so as soon as the adhesive goes on and you've cured it, you're basically at that point, the hybrid layer is starting to mature. So the hybrid layer obviously being that kind of interface between the hydroxyapatite, a little bit of the collagen, and your resin monomer particles. But that bond, once you've cured that, that's when the clock kind of starts. So you tend to think that a lot of the studies that they've done, if you were to just inject a big bit of composite right on top of that, and it's kind of bulk fill type technique, all of the shrinkage of the composite, if you do it straight away, the bond hasn't fully formed at that point. So you tend to find all of that shrinkage, and the flow of the composite is basically shrinking towards like the kind of greatest centre of mass of the composite. And by doing that, because you've got that shrinkage, it basically then just pulls the adhesive layer off the tooth or weakens that bond as well. So the concept is basically that after about a minute, you'll have about 70% roughly of your total bond strength, whatever that total bond strength happens to be. And after about 5 minutes, you'll roughly have about 80-90%. So that's kind of what you're aiming to give it, just a little bit of time. But it's not a case of, I think when I first heard that, I thought, okay, so it's a case of you do your etch, prime, bond, and then you're just kind of sitting there waiting, not doing anything. But there are things that you can do in that 5 minutes as well. So the thing that they would usually suggest in a lot of the kind of lessons and stuff would be to put just a little layer of what they call resin coating. So that would be basically your little kind of 0.5 millimeters probably of some flowable composite. And because it's such a low volume, you basically find that flow of the composite, it goes towards that hybrid layer. So it's kind of maintaining that bond strength. It's not pulling it away. And that clock at that point is still ticking. So that's increasing your bond strength there. You then tend to find as well that the rule is that, from what they've read, that if you go more than about 2 millimeters in your first increment in that 5 minutes, you're at chance of losing about 50% of the bond strength in a lot of the studies. So they recommend basically the simple rule of not getting any deeper than 1.5 millimeters within the first 5 minutes. And at that point as well, you could easily be doing that first 1.5 millimeters. You could be building up your little proximal wall as well, which isn't then connected to that composite that's forming the hybrid layer. So it's not like you're sitting there doing nothing. I think that's a simple kind of thing to understand, and something that you could easily kind of incorporate. And if you just kind of understand that bond takes time to develop, I feel like it really changes the way you look at things a lot of the time when you're doing composites and that sort of thing. And I think,
listen, Taylor, I'm just gonna just go have a coffee for like 5 minutes, and then that's still decoupling, and I can justify that to my patient. So that's the other way to do it. But no, I prefer your way. You made it really tangible there to add a little bit of flowable. That's great, and then could you be curing that flowable, and that's still, the clock is still ticking.
Yeah, that's right. So you would cure your flowable, and as long as the shrinkage of the kind of polymerization shrinkage tends to be to do with like the volume of the layer, and also the kind of modulus of elasticity as well. So because it's such a low volume, you tend to find it doesn't have that strength to kind of pull away from the first layer anyway. So that's why.
So you could be curing that flowable. You could doing the contact area on the matrix, and then like you said, so you're not connecting it to the body of the composite elsewhere, obviously, and then you can be just getting that. So yeah, I think fill in 5 minutes, and I would like to encourage everyone to practice taking quadrant photography photos. So get your buckle mirror, make sure it's nice and warm, or if you're using rubber dam, it's not an issue because it's not going to warm up, it's not going to steam up, and then you can start taking some photos and improve your photography. That's easily a minute that you can do there. So I would encourage everyone to do that. So that's a top tip. So great. So you mentioned about the decoupling time. Give us one more top tip, because this is such a big, huge topic. If anyone gains something from this episode, I want to remember, okay, I've improved my bond strength in some way. So give us one more tip.
So I think another one of the big main biomimetic concepts, which I think you'll have heard of yourself as well from, I know you're a Pascal Manu fan, aren't you, Jazz?
Of course, who isn't?
Yeah, so so the kind of immediate dentin sealing concept. So that's basically the concept where you've got your freshly cut dentin, and if we say, for example, this time we're going for an indirect onlay type of restoration. I know from when I was at dental school, I would have thought, just do the preparate. Well, first of all, I probably wouldn't have thought to do an onlay. It would be a crown I was probably thinking of, but if I had thought onlay at dental school, it would probably be do the preparation, taking the impression, that sort of stuff, and then at the time just cementing it with your etch bond, resin cement, that sort of stuff. The concept of the immediate dentin sealing was basically with your freshly cut dentin, when you've finished your prep, you're then, just as we were saying, whichever system you're using, the etch, prime, bond, your layer of adhesive, and then again possibly that little resin coating over the top as well. And by doing that, I don't know if you've read some of the papers by Pascal Manu as well, he basically has found that by doing the immediate dentin sealing, provisionalising that and then cementing it the next visit, because you've been allowing, similar to what we were saying in that first point, because you've given it, say potentially if you're sending your lab work away and it's coming back in 10 days, 2 weeks, that's potentially 2 weeks of decoupling with time that you're doing. So he's finding you're getting 4 times the bond strengths with using that kind of method. Things like that, though, there are still some areas that can kind of trip you up as well. So that's what I'm saying, to be careful that you can't just start thinking, right, okay, I'll start doing this tomorrow. So things like because it's such a thin layer that you're using there, you've got the little oxygen inhibited layer as well. So if you have this little thin layer of resin coating, there's potentially, say, I'm not sure exactly, but maybe 20, 30 microns at the top of that just isn't polymerized. So that can also react a bit with the impression material. So they would usually recommend a little bit of the kind of glycerine.
With the temporary material like bisacryl?
Yeah, so that, and also the actual, if you were using a kind of impression material to actually take an impression, it can interfere with that as well. I think it's more the kind of polyether type materials that can interact with it. So you basically want to make sure that you are curing through a little layer of glycerine, similar to when you're doing a composite and you cure that last layer through the Vaseline or that type of thing. So definitely do that. And then also just making sure, I think some people do the immediate dentin sealing and maybe think you can just use your etch prime and a little layer of the adhesive, but you tend to find at times that layer of adhesive, you have to know the thickness of it as well, because if it's about as thick as the level of the oxygen inhibited layer could potentially be, you could potentially just have pretty much nothing there. So that little layer of the resin coating over the top, it provides, I think the concept is it kind of provides more of the free radicals for it to all polymerize, and just make sure you have that good thickness. And I think it's definitely something to go away and read about and see if it's something you can maybe incorporate in your practice as well.
I encourage everyone to read about IDS, immediate dental sealing, but as a practical dentist, I think there are some other advantages, i.e. if the temporary comes away, then there's less sensitivity. That's right. Okay, that's a real good advantage there. The other one is, at the same time as doing my immediate dentin sealing, I'm blocking out any undercuts with my genial flow, whatever. So, if you just do it for those two reasons alone, and then now, if you get some added improved bond strengths, which we think we will, then it's a great thing to do. I think it's very, some young dentists might get scared away from it because it sounds very complex. It really isn't. It's just your standard adhesive procedure, bit of a flowable resin coating on top, and then when you come to fit it, the whole air abrasion. I would suggest everyone checks out the episode I did with David Jadole. With the episode we did with David Jadole, Extreme Bonding. David is a very well-known biomimetic dentist as well, and he talked all about the main things we can do to improve our bond strengths, and yes, one was talking about how we can use those concepts. So that's great. We've covered 2 top tips there for improving your bond strength. Number 1 was decoupling time, and number 2 was immediate dentin sealing. Let's switch gears to Caries Detector dye, because the biomimetic community is the community online that I see using as part of their protocol caries detection dye the most. And then so Herman influenced me to start using it, and I love it. I think it's great. I love that objectivity that it gives. So if no one's ever used caries detector dye before, can you just explain the steps in using it? And then B, how do you interpret that information, that tooth you're looking at now that's pink or green, depending on which one you got. I got the pink one. And then based on what you see, how do you act upon it? So it's 3 levels of questions. Okay, so why should we use it? How do you interpret it? And then how do you act on it?
Yeah, so I would say, like you're saying, the Caries Detector dye, it's probably another one of those ones that is seen as a bit controversial, maybe with people that don't know exactly the methods you could consider, using it in. So it's definitely not just a case of you're using this dye and it's helping you see, all the occlusal caries and you're just drilling away all the red stuff. I would say I would probably break it down a bit back to how you're actually wanting to deal with your caries removal biomimetically, possibly. So I would personally, I think the kind of partial caries removal concepts make sense to me, and the main things that I would usually associate that with would be forming that peripheral seal zone and getting your caries removal endpoints. So if I was able just to say what both of those are, it's the peripheral seal zone would be basically,
which is exactly what we were taught at dental school. Get the ADJ super clean, and it's just an extension of that, and the really linking it back to your bond strengths. Because we said, they teach me at dental school that because that's where your seals are most important, but that's where also we want to maximize our bond strengths as well. So it makes sense.
That's right. Yeah. Yeah, definitely. And then your caries removal endpoints, similar to the concepts you would learn at dental school as well, but maybe just making it a little bit more tangible would be once you're approaching the pulp, basically. And it's something that you're probably doing at dental school and without really realising it, but you're getting towards the pulp, you're starting to get a bit cautious, should I keep taking away any more? So the caries removal endpoint concept was basically, it was giving you like a tangible set of numbers to follow. It changes a little bit depending on, tooth to tooth and the age of the patient and stuff, but it was generally looking usually about 5 millimeters vertically. So that would be from, if you were coming occlusally removing caries, once you get 5 millimeters deep, roughly, you would consider, even if there is still caries, you would be stopping there. And horizontally coming from the marginal ridge of the adjacent tooth, so that's kind of your little 3 millimeter peripheral seal zone, you're basically then stopping there to avoid pulpal exposure. So you've got your clean peripheral seal zone, and then you're possibly a little bit of affected dentin, that type of thing, with a little bit of caries left behind that you're willing to accept the slightly lower bond strengths, and instead of basically exposing the pulp. And I think it's at that point that the Caries Detector dye, I feel, could be really useful. So to use the Caries Detector dye, if I talk a wee bit about what it is first, so the benefits of it, I would see, it's basically like, I think you mentioned as well there, Jazz, it's kind of giving you an objective way of looking at caries removal rather than being subjective. And I heard,
and that subjectivity has been studied, and every dentist is different in terms of where they stop. So I was attracted to it because you always question, should I remove some more? Should I not? And it surprised me enough. A couple of times, I use it many times, and I was like, okay, I'm doing good. And then I got surprised. I was like, whoa, had I not used this, I would have missed it. And I like what Herman said on a Facebook post recently. Like, yes, there are those people who argue that, I just use my probe, and I can feel it with my probe. But are you going to really be able to probe every square millimeter of your cavity? Yeah. Probably not. And that's got me thinking, is that, yes, he's right.
That's right. And then another thing with the probe as well that I've heard David Alleman as well talk about quite a lot in a lot of his lectures. I think he talks about, I think it was from a kind of Japanese researcher that came up with it all, and I think he would be at his dental school clinic and talking to the students, and a lot of the time they would be removing caries, and he would tell them, just keep removing it until it's hard with your probe, and they would then ask him, well, how hard? And that's a good question as well, because like how hard is hard? So I think Caries Detector dye is a good way of basically the way it works. Not sure if they know exactly how it works, but it stains denatured collagen, so it's basically a solvent type solution. It's got some acid red. The carious dentin, so the likes of the affected and infected dentin, the collagen fibers are a bit looser and they're denatured, so it's able to penetrate a bit more, and by doing that it then stains the kind of red or pink type colour. So I mean, the studies that you read about it, they're all pretty, I feel like they seem all pretty conclusive, to be honest, that it does seem to work. And as long as you're kind of accepting, there maybe are some limitations to it as well, and that really deep dentin that you get really close to the pulp could potentially stain a little bit red, but at that point you've stopped your caries removal because of the endpoints anyway, so it doesn't really matter at that point. And I find from using it a lot of the time, if I think I've taken away the caries from that peripheral seal zone, I'll put the Caries Detector dye on, and a lot of the time, like you're saying, you do get a bit of a surprise at times, and even if there's little patches that you think, you kind of look at and feel with the probe and think, oh yeah, fair enough, I've left that bit there. So and it is good then that you can see the area over the pulp that you're kind of leaving as well, and roughly, depending on, I think you can kind of tell a little bit the redness in terms of how red it is or how pink it is, roughly what you've got to work with in terms of your bond strengths and that type of thing as well.
Guys, everyone listening or those watching, there's an episode coming up with Herman. Actually, we're going to talk all about, a whole 45 minutes all on Caries Detector. But what you've done is given us a nice introduction. You got dentists thinking now maybe about it, so we whet your appetite for the one with Herman coming soon. I was actually going to record with him straight after you, but we've had to reschedule that. But we will cover that in good depth. So brilliant. We've covered some biomimetic principles. We defined biomimetic dentistry. We talk about Caries Detector just now. You gave your top tips for improving bond strengths. So as an introduction, as a final part of this podcast, I see a lot about crack management, and now managing cracks is very polarized, like a lot of things in dentistry, I guess. and many schools of thoughts will manage cracks in a different way. So I've been taught before, chase cracks. I've been taught before, never chase cracks. And what I do, hand on heart, will vary in every single case. It's different to me. If it's a nasty crack, I might chase it more. If it's not so bad, I won't chase it so much. So can you introduce us to the biomimetic philosophy or thinking or protocols when it comes to crack? And I imagine this, I don't know, crack removal endpoints. What names have you got for that?
Yeah. Yeah, so I feel like the crack element of it, I think that's one of the parts of it that's probably especially tough for me without having the years of experience at things, because I am kind of going purely just based on like theoretical, listening to what other people have to say and just kind of
that's fine, share, because this is new for me. The biomimetic approach is absolutely cool. Just share what you've picked up so far, and maybe in 5 years we'll record again and see if thinking's changed anyway, but share what you've learned so far.
Yeah, so what I've kind of learned so far would be, I've learned from David and Davey Alum, and they had quite a good way of assessing. So cracks were kind of forming a part of, they were quite good at teaching us ways of kind of assessing a tooth for structural compromise. So there were basically 4 red flags that they told us to watch out for. So the first one was obviously cracks into dentin. The second one was any kind of restoration, say an amalgam that's got an isthmus width of greater than 2 millimeters. The reason
which
for
is most amalgams.
Yeah, that's right. I know most of them. Yeah. And the reason for that was basically, I think, more studies by Pascal Magnier and several other people that basically show that when you do have an amalgam like that and it's got, say, an MOD cavity that's more than 2 millimeters, instead of the usual, the tooth can flex about 2 or 3 microns with even an amalgam in there, it's flexing about 180 microns, which is, a really big difference. So that's one of the reasons why these big amalgam teeth, do tend to crack as well. The third one was any cusps that are less than 3 millimeters in width, which quite common as well. And the fourth one was,
let's make that one really tangible. Where do you measure that 3 millimeters from? Do you measure it at the top of the cusp or the base where the cusp then joins on to the floor?
Yeah, so I've seen some different answers for that one as well. I would tend to have mostly seen from the bottom of the cusp, and you can use the kind of calipers. That's the way I've tended to do it. And I think that kind of makes the most sense, because that's showing you how much connection that cusp actually has. That kind of,
it's the base, the main strength of that cusp comes from what's below it. So absolutely, that's fine. I just thought I'd mention that so that people listening can think, how do you begin to measure it? So that's fine. Please tell us more.
That's good. And then the fourth last one there was any kind of box dead, so an interproximal box that was less more than 4 millimeters. So that's another reason that a tooth will be structurally compromised, because like we were saying at the start, you're then into that kind of biorim area as well. So then if you go back to the first one, which was the cracks into dentin, if I even just talk a little bit about, it was Davey Alum at the course, it was kind of a little talk about cracks and that type of thing. And his concept was basically, I think he's spent a lot of time, and obviously David Alum a lot of time, they've spent a lot kind of looking into the engineering aspect of it and seeing how engineers deal with cracks in other industries and things like that as well. And they've kind of come to the conclusion that if you are to just leave a crack as it is, then it has the chance that can always propagate no matter what you do. If you're putting force on that tooth, that crack can continue to propagate. It might take a while. So their concept is that, similar to the caries removal endpoints, you've called it crack removal endpoints. So basically that inside that peripheral seal zone, the likes of Davey Alum, he would tend to try and chase that crack as much as he can, basically wanting to try and avoid any pulp exposure or perforation or anything like that. But he'll feel that if you can either remove that crack or at least remove a bit of it, then you're kind of reducing the length of the crack. And by reducing the length of the crack, you're kind of reducing the lever arm of it. By doing that, it then needs a lot more force for that crack to then propagate. So he kind of sees that as the best way of doing it. It tends to be the only thing that I see with it as well that kind of challenges it, is that you've then got these areas that you've cracked, really high like C factor situations to try and then restore back, and you're kind of thinking, I wonder if is that any better what you've kind of made there. But so I'm kind of the mind that I've personally not really decided. I'm probably like yourself. I'm still.
I still don't know. Look, I've been in 9 years. I still don't know what is the best way, and I think it will vary in every single scenario. I just hate cracks, man. I think episode 27 was my title. I just hate cracks with a passion.
Yeah.
No one likes cracks, and there's so many different opinions. One of my friends, colleagues, Pascal Venuti, which I know he's like the anti biomimetic dentist, and that's cool. It's okay.
Yeah.
And he's very much like, don't chase cracks, because if you're chasing cracks, you never know where that end point really is. You can't see the end point. But you mentioned briefly, in case anyone missed it, is that actually if you're removing some of the crack, you're improving the mechanics of the situation. So at least we have the 4 themes that you touched on when it comes to crack considerations. So if you have a crack and it fulfills all the other 4 factors, and you think the crack is interdentine and it's got isthmus larger than 2 millimeters and more than 4 millimeters, was it 4 millimeters in terms of the depth of the restoration?
Yeah, so just the depth in general of the restoration.
Sure.
So I'd imagine just from the marginal ridge to the deepest point, and then you're into the kind of biorim at that point.
Yep.
So they tend to say then if you are kind of beyond that, trying to bond, a tough bit of ceramic into that really deep box, it creates a lot of stress in that area. So that's when you'd maybe be considering the likes of the deep margin elevation with a material like composite, which might have a wee bit more flex in it as well, which is another benefit of that sort of technique as well.
Mm-hmm. Brilliant. I think we've covered a lot of breadth, and I think wherever you're listening and watching this, give Taylor a round of applause, because it's not easy to talk about these kind of concepts, and I really I'm so happy to see what you're doing with how proactive you've been, how you've been open to the universe in terms of a learner and a sharer. I think good things happen to those who share. Please continue to share your journey. I love it. It's wonderful, Taylor. So thanks for making time to share your learning with all the Protrusive, and I hope you guys gained a few lessons. If anything, it may have whet your appetite to learn some more, which is a beautiful thing. And maybe you disagree with some of the concepts. That's okay as well. Like I always say, guys, it's okay to disagree with your management of cracks, which may be different to the biomimetic way. It's completely cool as long as you have your own philosophy. If you have a philosophy rather than winging it the whole time, which it kind of sounded like I did with cracks, I promise you I do have a bit more philosophy to it. But yeah, no, thank you so much. Any last words, Taylor?
No, just thanks very much again, Jazz. And yeah, I kind of reiterate again that, I mean, you've covered it enough, but I'm very, very early doors in my career. I'm just kind of exploring all of these concepts, not necessarily then taking all of it into work. So if anyone's kind of listening thinking, what is he doing at this stage to do all this sort of stuff, then I feel like I'm doing it kind of safely, and I think I'm being sensible about it. And if anyone's got any kind of questions or wants to ask anything about anything at all, then feel free. I'm more than happy to talk to anyone. If there's anything you think would help at all, then feel free to get in touch.
Reach out to Taylor, guys, at The Hybrid Layer. Again, I always encourage young dentists who are keen to learn, who are proactive, and who go on courses like you have, and you're doing things that ultimately is going to improve your dentistry, improve your outcomes, and you're on the journey. Right? Every master was once a disaster, right? So we've got to be on our journey, and the reason I got you on is because you've spent time to think. You've really, read the books. You've been on some courses. You're still early. You still need to drill some more teeth. You still need to remove some more cracks. But I feel as though your journey is valid, and your learning and your sharing is valid. So keep going. Don't think that, I can't talk about this because I'm not experienced enough. Sharing is absolutely a good thing to do. So keep it up, my friend.
Sounds great. Thanks very much, Jazz. Thanks very much.
Thank you so much. Well, there we have it, guys. Thank you so much for listening all the way to the end. Hopefully now we're a little bit more clued up about biomimetic dentistry. Do check out Taylor's website. I'm going to put everything in the show notes for you. And if you've listened this far, you might as well claim CPD. Like, it's just 4 or 5 questions away from getting a simple certificate that you can use for your end of year quota, but also to validate your learning. And it's a space for those of you who like to reflect and like to make notes. You can do that. Of course, speaking of notes, all those premium notes that you see on the side, or if you don't see if you're listening, you can download them as a PDF. So every episode within about 48 hours, we publish on the app. That's the Protrusive app on Android or iOS. Do download it. Do get stuck in. Join the community and gain CPD, but also watch the exclusive monthly content. That Protrusive Dental Pearl at the beginning of masking a post, that was actually taken from December's premium content of actually showing you how I fit 3 Emax crowns and a Emax veneer under rubber dam, a full clinical walkthrough, as you've seen perhaps on some videos on YouTube. YouTube. So if you like that kind of stuff, do check out the Protrusive app just for you, the Protruserati. Thank you so much, and I'll catch you next week.